The state of Illinois has surpassed a grim milestone. There are now more than 30,000 confirmed coronavirus cases across the state, and Saturday matched its deadliest day so far. That comes as new data shows that nearly 1 in 4 of the state's coronavirus deaths are tied to nursing homes. Joining me now is Democratic Senator Tammy Duckworth of Illinois. Senator, thanks very much for being on the program. This is clearly a significant, the state is having an unbelievably difficult time. It is arguably one of the centers to watch in the United States, particularly in Chicago. What do you need right now in the state of Illinois from the President of the United States, from the federal government, in terms of testing, in terms of other needs? Do you feel as though the state is getting what it needs from the federal government?
Well, we need the test kits, and the president has long promised test kits, and he has not provided them per his promise. Time and time again, he has said he will send us these test kits, and we still haven't received sufficient quantities of the testing. That's the key, is to actually be able to test people in a widespread manner, and then to also be able to do contact testing, contact tracing, so that we can know where people have been. We also need ventilators, and the president's been promising us ventilators and PPE, and my goodness, he has not delivered on that at all. In fact, our governor had to fly an aircraft to China on our own to go purchase PPE and bring it back into Illinois. And we had to actually keep that secret for the federal government for fear that the federal government would actually come in and confiscate our PPE that we desperately need for our frontline folks, in nursing homes and hospitals and our first responders. It's really criminal what this president is doing when it comes to failing to provide the resources all of our states need.
The president and his team have been talking about states and their plan for reopening, this idea that some might be ready for a phase 1 move toward reopening. Is Illinois anywhere close to that yet?
We are not anywhere close to a reopening. One of the things that we did well, actually, was to put people into a shelter-in-place fairly early on. We have actually bent the curve. I was in Illinois traveling across the state. We went out to the Quad Cities. I went to the McCormick Place, which is our additional site for additional hospital beds, and we have actually made a lot of great progress there. It's because we maintained shelter in place. So we're nowhere near ready to start reopening the economy in the way the president wants. If we want to do that, then first we need testing. We need more testing. We need more contact tracing, and we need to make sure that we open the economy. We do it in a methodical way, not just because the president is worried about polling or what his friends in business and CEOs are telling him. I'm more worried about individual Illinoisans who are right now for fear of dying.
Where do you stand on the emerging agreement that seems to be developing among the leaders in the Senate and the House, and apparently with the administration, to send more money to small businesses? I think it goes far enough. It seems like the money for state and local governments is going to be left on the table or punted to a future bill. What's your response to how this is shaping up?
Well, I do think that we need to send more money to small businesses. In Illinois, small businesses are 95% of our employers in our state. They desperately need this money, and I have no quarrels with sending more money to small businesses. I just want to make sure that we get money to hospitals and first responders, all those folks who are on the front lines. I've heard from my hospitals, both in big cities like Chicago, but then also in rural communities, that say they are on the ropes. They need a cash infusion in order to keep fighting this pandemic. So I want to make sure that the money gets to them as well. And then, of course, I do want money to go to state and local governments, right directly to the municipalities who are just barely hanging on themselves. They've bore the brunt of the cost of fighting this pandemic, and they've lost revenues from taxes. They've lost revenues from sales tax and all sorts of places, but they're still out there fighting every single day.
Let me ask you, Senator, and we are, of course, thinking of the first responders in your states and across the country as we talk about the challenges every state and locality is facing. But also more personally at home, you're at home. All of us are trying to work in some cases with small children around balancing all of that. I know you are also a relatively new mom. That's not a terribly common thing in the U.S. Senate. How are you balancing all of that and trying to figure out your work from home scenario?
Well, it is every day. It's a team effort. I am very fortunate that my mother lives with with us. I decided that my mom would shelter in place with us. She's 79 years old. And she helps, and I don't know if you can hear her, but I can hear in the district background. She actually has the 2-year-old right now who's crying, and my husband just took the 5-year-old into timeout because she wanted to turn My Little Pony up on high blast while I was here interviewing with you. And I said, honey, mommy just needs 10 minutes without My Little Pony on the higher setting, and so she's actually in timeout because she threw a fit. My husband just took her upstairs.
Well, please tell her that we appreciate the break from My Little Pony. I'm so sorry to have intruded into your family life. And that is, mothers are such a blessing. I don't know what I would do without the help of my own mom. So, Senator Tammy Duckworth, thank you very much. We will, of course, be checking in with you as Congress continues to wind towards a deal. Meanwhile, the subways and